So welcome to another episode of CortexMedicine, and this is a PYQ. The topic of today's topic of discussion, this video is myasthenia gravis. Okay, so myasthenia gravis, as I told you in previous video, that myasthenia gravis affect postsynaptic acetylcholine receptor, okay, or acetylcholinesterase inhibitor receptor, okay. So what patient present with diplopia, ptosis, dysarthria, dysphagia, dyspnea. The diplopia and ptosis is like first symptom, and weakness is considerably proximal limb neck extension, generalized weakness present. It is fluctuation in fatigue. Physical examination, you will see this. The important part of this is laboratory testing. In the acetylcholine receptor immunoassay present in 85% positive in generalized myasthenia gravis and 50% of ocular myasthenia gravis is present. Definite diagnosis if positive. This is important. If negative, does not exclude myasthenia gravis. This is important. This is direct from medicine. 40% of acetylcholine receptor antibodies negative patient have generalized myasthenia gravis have anti-MuSK antibody and 2% have LRP4 antibody. So we have three antibody till now. Anti-acetylcholine receptor antibody. Okay. One is anti-MuSK antibody and third is LRP4 antibody. These are the okay. This is important test, repeated nerve stimulation test. Decrement of more than third at 3 Hz important. It is 3 Hz, highly probable. Single fiber electromyography, blocking and jittering with normal fiber density. It is not specific. Or hydrophonium chloride, that is 2 plus 8 mg, highly probable diagnosis if unequally positive. Okay, eye spec test looking for improvement. TOS is very sensitive. And for ocular cranial, exclude intracranial lesions by CT or MRI. So these are the investigation we do. Eye spec test, cold temperature, it improves the conduction. It is usually a very good sensitive test, so you can do it in the OPD basis. Hydrophonium test, 2 milligram hydrophonium IV, and neostigmine test, 1 milligram IM. Symptom improve, most likely to be myasthenia gravis. Acetylcholine receptor antibody, it is the most specific test. I told you already. And single nerve fiber electromyography increase the jitteriness. It is the most sensitive test. What are the nerve conduction tests? First is what is important. It is this is important. Low frequency 3 Hz repetitive nerve stimulation test. As you know that if as you know that if we repeatedly stimulate post nerve endings, the acetylcholine release will the already present एसिटाइलकोलिन जो एसिटाइलकोलिन के जो बंडल है वो ऑलरेडी जो प्रेजेंट है वो क्या हो जाएंगे, डिक्रीज होते जाएंगे. डेट विल डिक्रीज इन रिपीटेड स्टिमुलेशन एंड देयर विल बी रिडक्शन. ओके, द डिक्रीमेंटल रेस्पॉन्स इज सीन here. Okay, if you see, okay, but if you see in the LEMS, Lambert-Eaton syndrome, high frequency repeated nerve stimulation 100% incremental. Okay, here increment, but here is 100% increment. It is important. The second part that is important is reduction of amplitude. What is low frequency test? Reduction of amplitude of evoked muscle axial potential by more than 10%. In normal percent, it does not change by more than 10%. Okay, that is, it means it is decremental. Okay. Second, thymectomy should never be carried out as emergency procedure, but only when the patient is adequately pre-prepared. Okay, if necessary, treatment with IVIG or plasmapheresis may be used before surgery to maximize strength in weak patient. Okay. Second is what is they always confuse with Lambert-Eaton syndrome. Okay, so it is the autoantibody against P/Q type calcium channel that impede the release of acetylcholine from the terminal. Okay, is presynaptic. What is that is myasthenia gravis is postsynaptic. It affect the proximal lower limb muscle. Myasthenia gravis affect the ptosis, means affect cranial nerves. It affect cranial nerve finding. Most common affected, earliest affected. Other, yes, other nerves, all other muscle also affected. In 70% of patient, cranial nerve finding, ptosis and diplopia is present. In myasthenia gravis, it is also present. If you see the reflexes, the reflexes is here is absent or depressed. It is most important. Remember this. And the autonomic changes is seen in the Lambert-Eaton myasthenia syndrome. Okay, dry mouth and impotence is seen. On nerve stimulation, decremental response is seen on myasthenia gravis frequency 2 to 3 years, but this is important, but at higher frequency rate. But at higher frequency rate, beats to 20 to 50 Hz high frequency, incremental response is seen because acetylcholine will release more and more. Okay, mean or exertion. Okay, uh, increase contraction or decrease weakness if you see. Okay, exertion पे क्या होता है, weakness decrease हो जाएगी. If we say in young adult, it is not associated, young females, it is not associated with cancer, but in the older adults, it is associated with a malignancy, small cell lung carcinoma. Okay, as tumor cell express calcium channel that antibody work against it. In the myasthenia gravis, a thymus cell, on thymus cell there is a acetylcholine receptor that work as antigen. Here the calcium channel work as antigen and antibody makes against it in the tumor cell. Okay, small cell lung carcinoma. Treatment is plasma exchange and immunotherapy, and a drug that is important is 3,4-DAP. It is inhibits the calcium channel and prolong depolarization of motor nerve terminals. Ultimately, it increases the acetylcholine release. Okay, so important is the orange what the orange letter or orange color showing the major difference between the myasthenia gravis. Okay, I hope you love this. Thank you. Keep sharing.